Welcome everyone to this webinar on health insurance options for small businesses. This webinar is being hosted by the Maine Small Business Development Center in partnership with Coastal Enterprises. And my name is Christina Oddleifson, and I'm a small business advisor with the SBDC, and I am at USM in Portland. I cover Cumberland County. And I'm joined today by Cameron Monaghan, who is with the Workforce Solutions Group at CEI. And we're really fortunate to have him here today because this topic is one that we get a lot of questions about as SBDC advisors. And as we all know, healthcare can be complicated and confusing and expensive for small business owners. And we're really grateful to have Cameron here today, who's going to be doing the heavy lifting and really presenting this webinar so that we can get some of these things demystified. And next slide there, Cameron. So just some details for you to know about before we get going. This webinar is being recorded and it will be posted on our YouTube channel, which is public. So you can always find it there. You can go back and review it. If there's a reason that you may not want to show up on that recording, you might want to turn off your camera. You will be sent the slides from this presentation in a follow-up email, typically within a week, and it will have the links to resources that Cameron has put together for us. And this is probably a somewhat complicated topic, so we're asking that you put questions in the chat, and then at the end, we will start reviewing those questions and have a conversation. We should have plenty of time at the end to get to those, but we're not going to answer them as we go along. Next slide, Cameron. So just a little bit about the Maine Small Business Development Center. If you are not familiar with us, we are an organization that really exists to support the small business ecosystem in the state of Maine. And we are part of a national network of SBDCs that exist in every state. The program has been around for almost 50 years, and the Maine SBDC was one of those original groups that came on board with the SBDC. And here in Maine, we have 12 full-time advisors who are placed all over the state. And we are people who either own businesses in Maine or have business degrees, but have been down that road before you. And we are generalists. We talk about lots of different topics. The list you see in front of you are topics that we're often in conversation with people about. As a disclaimer, we are not lawyers or accountants. We can talk around those issues, but once it really gets into something specific, we will refer you out to an accountant or a lawyer if we need to. And basically, the core of what we do is this one-on-one business advising. It's no cost because it's taxpayer funded. It's entirely confidential. And if you're interested in connecting with an advisor about a business idea or a business that you run or a business you're trying to exit, then just go to our website at mainesbdc.org and you can sign up and then get connected to an advisor. And also on our website, you're going to find other resources like e-courses, and you can sign up for our newsletter, and there's blog posts and all kinds of other ways to get information about owning a small business and the many, many different topics that come up as you're a business owner. And next slide, Cameron.
Sweet.
So,
Oh,
yeah,
sorry.
so this is where Cameron is gonna take over and tell you a little bit about CEI, Coastal Enterprises, and then we'll launch into our discussion.
Awesome. Thank you very much for that introduction. So yeah, it's going to be a lot of what you just heard on the last slide because Coastal Enterprises does similar work. We also provide business advising. Our primary goal is to help encourage and cultivate, small businesses in the state of Maine. We're also a CDFI, which means that we're a lender to small businesses. So if you're looking for financing for expansion or to get a business started, CEI has flexible financing options available. in a number of different, sectors and for, different financial goals and what you may want to do with your business. We also provide webinars and informational sessions like the one that's being held today, partnering with other organizations like the SBDC. We have a couple of business lab cohorts that are specifically focused around industries. So our two that we're running right now are childcare and weatherization. So if you know anybody who's operates in those spaces, or if you operate in those spaces, that's something that you might be interested in. I provide workforce advising as part of the workforce solutions team. So this is more tailored to anything really to do with your staff, finding, retaining talent, benefits, navigating traditional basic benefits, some other things that can help encourage employee retention. And I'd be happy to discuss any of the topics that we talk about today in more detail after this. So you'll have my email at the end, and it's on the first couple slides there. So feel free to send me an email and just say, hey, I attended this webinar. I'd like to talk more about health insurance, or, I was thinking about retirement savings or something. And I'd be more than happy to discuss your situation in a little more detail after this. Then also we will help businesses become more climate resilient, get financing for solar panels, and help create a more sustainable economy or sustainable environmental situation for small businesses in the state. So with that out of the way, we'll talk about the core of what we're going to be discussing today, which is health insurance. And specifically, we're going to hit on three major topics. The first of which is why health insurance is important as a business owner with employees and also as an individual. Why should you want to add health insurance benefits as a small business? And then once you've decided that that is a route that you want to go, what are your options? Uh, Health insurance kind of carries this rightfully earned in some ways stigma that it's an incredibly expensive benefit to offer, which can scare a lot of people away, especially if they're not very familiar with some of the lower cost alternatives that are available. So we'll be discussing some of those options that you may not be familiar with outside of the traditional group health insurance that everybody knows and maybe loves, maybe hates from previous jobs. And then lastly, I'll be sharing a list of resources and tools that we use when we're advising businesses, and I highly recommend that businesses that want to explore health insurance use for themselves to get a better idea of what these plans might cost you. You can enter information into these tools and get a pretty good estimate of costs, and really allow you to compare the landscape of the options that are available that we discuss. So we're going to start off with just the basic, why is health insurance a benefit that you should really think about? And health insurance is regularly listed as one of the most important things that job seekers are looking for when they are applying for jobs. It's like slots in right below the actual hourly wage and compensation. And because of this, businesses that offer health insurance can really benefit from attracting, high quality candidates and keeping the staff that they have. Unfortunately, a trend that we see across Maine and the whole United States is that traditional group health insurance plans are very expensive, which means that larger, more established businesses have an easier time being able to afford to offer health insurance compared to small businesses and startups, which creates a gap in the type of candidates that are applying, right? It makes it easier for the larger, more established businesses to get more high quality candidates than smaller businesses in a very competitive job market. But luckily, there are some affordable options that are specifically tailored towards the needs and the economic realities of small businesses that you may not have heard of or may not be very familiar with. And that's really what the primary focus of today is going to be, is to highlight some of those affordable options that you can implement at your small business without, obviously hurting yourself financially, but also seeing those benefits of increased retention and an increase in interest from job seekers when you are looking to hire. So with that, we're going to start off by just highlighting the two main options that you have when you start to explore health benefits. These are a health reimbursement arrangement, or HRA, or small group health insurance. Um, there's a specific type of small group health insurance called SHOP that we'll discuss in a little more detail later on. Uh, but when you think small group health insurance, this is what you tend to think about. This is what people tend to think about when they think of healthcare, right? These are your plans that you may have had at a larger employer in the past. You have premiums. They're split between the business and the employee, how much you pay. There's, deductibles, there's markets, all that stuff, out of market, network, stuff like that. So, um, tiered plans, that's group health insurance. A health reimbursement arrangement is something that not as many people are familiar with, but is oftentimes the most financially advantageous for small businesses. And it's what we at CEI, when we're doing small business advising, oftentimes recommend to businesses to be able to offer health insurance to their employees, but stay within a very, fixed and manageable budget for this benefit. So with that, we're going to start off with the HRA. Um, Basically, just what is an HRA? The way an HRA works is it allows you, as the business owner and the business, to set aside a certain amount of money for each employee to reimburse them for the cost of getting their own health insurance. And a great thing about this is that these dollars are completely tax-free. And the business owner is in complete control over the amount that they are setting aside for their employees. With this, after you determine what the value is, the employee will then go and sign up for individual coverage on CoverMe or the marketplace if you're operating, in another state, but I'm sure everyone here is in Maine, so that would be the CoverMe's website. And they'd be able to enter their individual information for themselves as a individual or for their family, and they will be able to navigate through this marketplace and see what options are available to them, what their premiums will cost, and then they can select a plan and use this tax-free money that you've set aside to help pay for the cost for their own health insurance. So some of the benefits right off the bat here are flexibility. The employee has a lot of control to what plan they're selecting and what works best for them. And another thing that's really great about a HRA is that this money can be used to pay for a spouse's premium if the employee is on their plan. So if one of your employees is married and they're on a family plan with their spouse, they can use their HRA money at their job to help pay for their spouse's share of the premium at their place of employment on their plan. So it's very, very flexible. It is way more cost controlled than a group health plan because ultimately, as the business owner, you're setting how much this is going to cost you, per month because you're in complete control of how much you're setting aside. So the two main versions of an HRA are a QSARA and an ICRA. Um, there are some differences on maximum contributions and plan eligibility, but largely these work the exact same way as we talked about on the last slide. It's money that's set aside to be purchased or to be used by your employees to purchase their own health insurance. A QSARA is specifically for businesses with under 50 employees. An ICRA can be used by businesses of all size. And the QSARA, because it's more tailored for small businesses, tend to be a little simpler and maybe a little more affordable to manage and to offer. But largely, these plans are quite similar. The QSARA we do end up recommending more often just because it is tailored to businesses under 50, and we think that that works quite well for a lot of small businesses. But, to learn which HRA plan works best for you, it's always good to speak to, a business advisor or, an attorney that you have, or reach out to a licensed health insurance broker, and explain your business needs and the situation that you're in, to get their feedback on what option might be best for you. The QSARA does have an annual limit. If your employee is an individual, or if you're an individual, you can only set aside $6,350 in for contributions, which is about $529 per month. And if the employee is purchasing family coverage, then that amount increases to $12,800 or $1,066 per month. Another great thing about the HRA is that there are no participation ratio requirements like there are with group health plans. So we'll talk about that on the next slide. But oftentimes, when you're looking for small group health insurance, there will be a requirement that in order for you to receive the plan or the coverage, 75% of eligible employees will have to participate, which can be kind of difficult to when you're first adding insurance, do you like survey your staff? How do you make sure that you'll hit that metric? So with an HRA, you really don't have to worry about it, which is nice, and it largely leaves the responsibility to find plans that work for individuals up to the individual, which is quite convenient. So next, we're going to talk about the alternative, which is the small group health insurance plan. And like I said, when I was first, discussing the two options, this is the one that people traditionally do associate with workplace health insurance. So these are your HMOs and PPOs. There's a premium that is split usually between the employee and the employer. These are tiered by a metal system from bronze up to platinum. Typically, the higher the tier, the more expensive the plan is, but it may have more thorough coverage. And these plans can be found as well on CoverMe, um, where you can use some of the tools that we'll talk about later on to enter in information about your business, the age of your employees, the number of your employees, and get a pretty good idea of what type of small group health insurance plans would be available to you as a business owner to offer, and get an idea of what the average premium cost would be, and help connect you to a licensed broker to learn more if you are interested in finding small group health insurance. And then, as I mentioned on the previous slide, unlike the HRA, oftentimes these plans can require a participation ratio. So in Maine, in most situations, that number for private small group health insurance is going to be 75% of your employees will need to participate in this for you to be able to offer it. So that's something to keep in mind, especially if you employ a lot of younger people or if you know that a lot of your staff may be on their family plans. Make sure that you can confidently hit that 75% participation. Otherwise, you find it very difficult to find a plan that would voluntarily want to be work with you, right? Because they want to make sure that they're getting up to that 75% in order to offer this. And then, as I said, these plans can be quite expensive for small businesses, but there are some affordable options, particularly the Small Business Health Options Plan, SHOP. And what SHOP is this is a type of group health insurance plan, but it is specifically tailored to the needs of small businesses and can be more affordable than just going out on the marketplace and buying any old group health insurance. But it does work the same way. So, first things first, to be eligible for a SHOP plan, you must meet those listed requirements. You have to be located in Maine. You have to have at least one common law employee, which is an employee that is outside of the family. And you have to you have to have 50 or fewer full-time equivalent employees, and you have to offer coverage through SHOP. So if you select a SHOP group health insurance plan, you have to offer it to all of your eligible full-time employees. You can't have like a tiered system where you exclude certain groups of people based off of, their job title or experience or time with the business or anything like that. In order to offer a SHOP plan, it has to be offered to all full-time staff. So what actually is the advantage to shop? Shop plans are a very specific type of group health insurance that has been chosen to be eligible for the small business healthcare tax credit. So if you offer a shop plan, it can make your business eligible to receive this tax credit that can reimburse you up to 50% of your costs to offer health insurance to your employees, which which is a huge uh, incentive, right? It's a really big um, tax incentive to offer a SHOP plan. The thing is that in Maine, you only have one option, and it is through community health options. So if you were to select a plan with the hopes of being eligible for the small business healthcare tax credit, you would have to go through community health options and sign up for that SHOP plan. And if you are interested in this, you should reach out to a registered insurance broker and just say, I'm looking for a SHOP plan, and they can help you determine your eligibility, um, as well as make sure that you will indeed be eligible for the small business healthcare tax credit, because ultimately, that's up to the IRS, and it depends a lot on the more specific details about your business, whether or not you get that whole 50% reimbursement or not. So, largely recommend if you do decide to go this route with the goal of getting the small business healthcare tax credit, that you are very cognizant and working closely with professionals in this area so that you are confident before you sign up for a plan that you will indeed be eligible for that tax credit. So, next, we're going to just take a look at some of the resources and tools that are available to you um, through CoverMe. CoverMe is a great resource for businesses that are looking to learn more and really get a better understanding and dig a little bit deeper into the options that are available for health insurance in the state of Maine. This first tool is the small business coverage tool. This is a comparison tool that is very, very useful. It's basically you just log on, you enter information about your business, um, very basic stuff like the number of employees you have and their ages, the zip code that you're operating in, and how much you want to pay per month. So you can tell this tool, this is what I'm comfortable paying, and it will pull up pretty much everything that we've talked about today, and allow you to view and compare a snapshot of all of these options and what they would cost and whether or not they would be within that budget that you've decided and declared that you are comfortable contributing monthly. So this will compare the HRA, the small group health insurance, and it also throws in another option, which is just what if you just gave raises based off of how much this would have cost you alternatively. So it's an interesting kind of comparison to see if that's a valid option for you. But this tool is really great. I think this is a great place to start out just to get a very high level snapshot of which option may be the best for you. The next is basically the same tool, but it is for individual coverage. So if you decide to go with an HRA, uh, keep in mind that that plan will result in you and your staff then having to purchase your own individual insurance or family insurance. And if you go with the HRA, this tool, the plan comparison tool for individuals and families, is going to be your next location. This is where you will enter information about yourself and your family, and it'll give you all of the plans that are available on the marketplace that can be purchased if you're on an HRA, and then you use that HRA money to help reimburse for the cost of these plans. And another great thing about the individual plan marketplace is that you can be eligible for discounted rates and stuff based off of income and whatnot. So um, there are some very affordable options for individuals and families that you can find while navigating through the plan comparison tool for individuals. Then the next one is for the small group health insurance. If you decide to go the route of adding small group health insurance or exploring how much that would cost you, if you're interested to offer a group plan, this tool is tailored for that. So the merge market rate calculator is you'll enter your zip code that you're operating in. or the county that you're operating in, the number of employees you have, and then their ages. And based off of just that information, this will populate all of the available group health plans in the state or in your area that will meet your coverage requirements, and it will give you a pretty close idea of how much they're going to cost you. It'll say what the premiums are, and um, this will, when you first use this tool, it'll be kind of overwhelming because there are quite a few options. But the tool does a good job of showing you, as I mentioned, that tiered metal system, so you can get an idea of the type of coverage, whether or not it's an HMO or PPO plan or an HSA plan. It will show you what the deductibles are for the employees if you were to decide to select it, and it will show you what the premiums are. So this plan is really good if you're, set on small group health insurance and you've decided that that's what you want to do, and you don't want to do a shop plan. But if you do want to do a shop plan, then a great place to start is the shop eligibility tool on CoverMe's website, which, as it says right in the name, is used to determine if your business is eligible for shop. This is a great step before, contacting a broker to find and to sign up for a shop plan. Um, and again, just to reiterate, the IRS is the one who ends up determining the eligibility for the small business health insurance tax credit. So just because you're eligible for a shop plan and you enter this information, it doesn't always mean that you'd be able to get the full 50% tax credit reimbursement. But this will give you a good idea of if shop is a good option for your business and an affordable option and something that is worth pursuing. So then lastly, here's just kind of a collection of a bunch of different links that I think are worth exploring. There are some good stuff on here, like a lot of it's CoverMe, because again, that's a really good resource that you should visit if you're interested in getting health insurance for yourself and your business and your staff. They'll have pretty much everything that you need to be able to navigate this world of health benefits. The Find Brokers and Assisters Near You is a great link where if you're deciding to take the next steps into selecting one of these options, this will connect you with a local broker that's registered with the state. Uh, there are a couple of other things on here that are really good just to give you a little more information if you want to dig into some of these options in more detail. Uh, but really, I cannot emphasize enough that coverme.gov is a great resource, and there are so many tools available that allow you to, enter information that is relevant to you and your business, and it can give you a really good idea of what initially is off the table and what's on the table and what is worth exploring and dedicating your time to learning more about, because this is quite a difficult topic and it's awfully foreign to a lot of people. So you can really get sucked down into a rabbit hole, right? Trying to learn everything on your own. So using these tools and getting that quick summary, equipping you with the confidence to then take the next steps and speak to a broker or a business advisor or CEI's workforce solutions team. Come with questions about what may be best for you. I really, really recommend doing that. And as we said at the beginning, we're going to send these slides out after the meeting. So uh, you can click on these hyperlinks and access all of these resources and kind of peruse the information in your own time and at your own pace, which is great. So with that, that's really all I have. I haven't been keeping track of if there's questions in the chat, but please feel free to ask any questions if you have them. I know it's a lot of information, so I'm sure there's some stuff that you were thinking about.
Thank you, Cameron. We do have a few questions in the chat, and I also had a couple of clarifying questions myself. Could you actually tell us what the acronyms QSERA and ICRA stand for?
Yep. So a QSARA is a qualified. Actually, let me pull this up real quick because I want to make sure that I get it right. It is a qualified small employer health reimbursement plan, and a ICRA is a individual coverage HRA.
Okay. Um, and if you set up a Coursera, are you setting that up through the IRS to get that tax free, be allowed to give that benefit tax free, or do you have to go through a broker to set that up?
Yep. So you do set it up through the IRS. There's a form that you'll fill out. But I really recommend that employers work with their payroll company or a broker just to make it a lot easier to do because it
Okay.
can be quite difficult to manage all of that stuff like independently. So that's another great option too, especially if you're looking to go with the HRA route, is contact your payroll service provider and see if they offer assistance with it. And oftentimes that can be very easily integrated into the service that you're already using or already paying for. And it can really make that step a lot easier.
That's a great idea. Thanks for that. Probably one big question I know people have, and there's one related to it in the chat, is what if you're just a sole proprietor with no employees? Can you take advantage of a Coursera?
Yep. So, typically, if you are a sole proprietor, I would recommend just exploring the individual marketplace for individual plans for yourself personally. Um, Sole proprietors and S corp owners and partners, they cannot take advantage of HRA plans. So you would have to be a C corporation, and you can, if you're an owner of a C corporation, you can, set aside money for yourself through an HRA. But sole proprietors cannot use health reimbursement plans. Largely in that situation, I think that the best route is just to log on to the that second link that I showed, the second resource, which is the individual coverage tool, and look for, enter your own information there, get kind of a rundown of how much it would cost you based off of your income, and you can still be eligible for income-based subsidies. Since you aren't eligible for workplace health insurance. So you can get pretty good deals on those individual and family plans as a sole proprietor, but it wouldn't be through your business, if that makes sense.
So even if you are an S corp and an employee of your business, you would not be able to get that. You would not be able to do an HRA.
Correct.
Okay. Um, okay, we have a specific question about Gretchen is asking, do you know if the Coursera or ICRA work for an ESOP? Um, any ideas about administrative costs?
Yeah, that's a really good question. I can send out a follow-up. I I don't I believe that they could be um that an ESOP would be eligible for a Coursera or an ICRA, but I'm not 100% confident. So I will. Is it all right if I send up a follow-up email, or we
Yeah,
put that answer in the
yeah.
Outlook, and then also for the administrative costs, it varies depending on um, who your payroll provider is. I think we've in the past have checked. Paychecks and one other, and I think at that point it was about like $80 per employee, but it's all across the board. So as for administrative costs, I can't say for certain um, who
And
that
that
would.
would be an annual cost of
Yeah,
$80 per
yeah,
employee. Okay, to add that to your payroll service.
mhm.
Okay. And your understanding is that most payroll services would manage that
Yep.
for, okay. Um, Michelle is asking, do you recommend Shop over any of the others? It sounds like it would be a great option for our business.
Yeah, I mean, it's hard to say, based off of like the situation that you're in. I think that shop is oftentimes the best option if you've decided to go with group health insurance for a small business, right? Just because you do get those tax advantages and it is specifically tailored, for small businesses that are looking for affordable coverage. So in many ways, it is a great program. But it largely depends on a little more detail about like what your situation is and if you can reach like the 70% requirement. So shop does have a 70% participation requirement, stuff like that. But it can certainly be a great option. So as to whether or not I'd recommend it over like an HRA, it depends a little bit more context on the business. But I certainly think it's worth exploring and talking to a broker and talking to uh, business advisors and getting some feedback into what might work best for you.
And let's see, Elise just asked, could you repeat the sole proprietor recommendation?
Yeah, so oftentimes with sole proprietors, we end up off recommending that they just use the plan comparison tool for individuals and families. And what this is it is health insurance that is outside of the business. So in many cases, if you're a sole proprietor, um, you will still be eligible for discounted rates and subsidies and programs that make this more affordable for you. And the individual comparison tool will, if you use this and enter the information for yourself and your family, depending on if you're looking for individual or family care, then you will get to see all of the plans that are available on the marketplace and select one that is, affordable and works for you. And this is the same tool that if, an LLC were to go with an HRA plan, the individuals would end up using this anyway to select their coverage, right? So this is largely kind of what we recommend for sole proprietors. Oftentimes, this is what makes the most sense.
Okay, so single member LLCs, sole proprietors cannot use, and S corps
Mhm.
cannot use the HRA.
Correct.
If you're a single member LLC with employees, though, you could certainly offer that if you
Yep.
have at least one employee,
Yep.
right? Was
Correct.
that the, okay, so you have to have at least one employee outside the family to qualify for an HRA.
Mhm.
I just want to make sure I have
Yep.
that correct. Okay.
Correct.
Um, and just as perspective, Cameron, what are you seeing most small businesses in Maine doing through your work in workforce solutions? Is it that most are choosing the HRA option? So many of the businesses that we work with are like 5 employees or less. So we're looking at really small businesses. Are you finding that more and more people are adopting HRAs?
Yeah, so it's interesting because HRAs are still a relatively new option. They were created as part of the ACA, which now is probably like 15 years ago, but they're still relatively new. And a lot of businesses aren't familiar with them. So when they think about like health insurance, they sometimes get into group health insurance that then quickly becomes unaffordable, or their staff simply don't enroll at the rate that they thought they were in. So yeah, we are seeing a lot of people switch over, people who have been offering group health insurance over to an HRA, and people who are looking for low cost health insurance for the first time, going the route of the HRA for themselves and their employees.
Okay. And do you find that, and this is a broad question that maybe there's no answer to, but are most people opting to give up to that limit of 6,350 or whatever the amount was?
Yeah. No, it really varies. Largely depending on like what they can afford. So we really recommend that the businesses sit down and budget and like find out what works for them. But a lot of businesses start off $200 per employee per month, right? That they're setting aside, and then that they kind of can build from there, or year to year if say that something unfortunate happens and they can't afford to put that aside, they can adjust it at the end of the year to 150, something like that. I would say that's probably a little more common than people going in and fully funding it up to the limit, in their first year. So
Okay. And just from a mechanics perspective, the employer is putting this into people's paychecks as a tax-free benefit. Is that the mechanics of it?
yeah, so I am actually not positive how the distribution works. It's a reimbursement, so
Okay.
it
Okay.
comes, I believe, separate from the actual paycheck, and it is contingent on the employee signing up for the coverage. So it's not like everybody gets it, right, and then if they don't end up getting coverage, then they just get to like keep the money. It is contingent on the employees actually using the HRA funds on um, purchasing health insurance for themselves, a health plan for themselves.
Okay. So they have to show that they have paid their monthly premiums in some way, and then the employer reimburses them either through some mechanism.
Mhm.
Okay. We have another question. Does the money in an HRA have to be used in a specific time period?
Yeah, so no, but the money wouldn't be being set aside until the employee registers for a plan, right? So it's not like there's going to be like a big fund and then they have like a certain amount of time to go up and uh, once you enroll in the HRA, there will be a time period for people to go out and buy their own health insurance, and then they would be reimbursed for that, monthly or every 2 weeks, depending on how the money is distributed. So. No, it does not have to be used. It's not like an HSA, right, where you have like a year and it builds up and then you have to either spend it or it rolls over or anything like that. I know it's confusing because HRA and HSA sound very similar, but since it's a reimbursement plan, no, it's more so like they'll go out, they'll pick the insurance, and then they'll start getting that after they've selected their insurance plan, whatever that value is that you've decided to set aside. So.
Okay. Elise has asked, do plans have to be in the marketplace to utilize these programs? I had just called an insurance provider and signed up for an individual insurance that way.
Yeah, so no, not necessarily. It depends on the program that we're talking about, right? So if you are looking for like shop, then yes, then you would likely, I mean, community health options is the only option, and that is like on the marketplace. But even with and also we recommend the individual marketplace search as kind of the easiest for an HRA for people who are receiving an HRA to go out and look for insurance, but it does not have to be on the marketplace. You could do that. As I said, the HRA funds can also be used like to help pay for a spouse's premiums, so they're quite flexible. The marketplace just comes up, I think, because it's a lot easier for individuals to navigate the marketplace by, just entering that information and seeing the plans that have been put on the marketplace with that intent of having individuals register. But when we're talking about like small group health insurance and stuff, that exists, separate from like what we'd consider the healthcare marketplace. And that is more so like you call the provider, you register your business, or you go to an insurance broker and get your business set up with a insurance plan that way.
Okay. All right. Are there any other questions for Cameron? Okay, we do have another one. Sandy is asking, how would the structure of an HRA work if you have a bunch of part-time employees and your benefits are a percentage of their hourly wage?
Yeah, so you can offer a HRA to part-time employees, but also you can make them exempt and offer it only to full-time employees. So that is within your control. Um, but you have to offer the same terms and conditions to all employees within the same class, right? So if you were to offer it to part-time employees, it could be a different value than what you're offering to full-time employees, if that makes sense, right? So you could set aside, hey, all full-time employees, you're going to get $300 per month to put towards your premiums. If you're part-time, you either aren't getting anything, that's an option that you have, or you can get $100 per month, right? So, as for like the percentage of the hourly wage, I'm not like fully sure like what you mean by that, but but you could having part-time employees doesn't necessarily mean that like they have to be included in an HRA, and it doesn't mean that they have to be excluded. The choice is yours, and the amount that you are putting towards them is up to you as well. So if you are calculating that as like by using the percentage of their compensation or their wage, then that's a choice that you have. Yes.
And Cameron, are there any limits on the type of expenses that can be covered by an HRA, or is it just if an insurance company covers this cost, then you can get reimbursed? Or what if you go out and buy something that's not covered by insurance? How does that get
Yeah.
determined?
So specifically, unlike an HSA, which again, so confusing. I don't know why they had to do this with the names. An HSA is where you encounter like I have this money that I've been saving, and can I use that to buy like qualified medical expenses, right? So you can use that to pay for like co-pays and over-the-counter medicine and stuff like that. The HRA is specifically for purchasing health insurance plans. So an HRA is going to be solely towards premiums to get yourself insured. So the HRA money won't be used like for kind of these other expenses that you associate with healthcare, like co-pays and deductibles or anything like that. The HRA funds are solely to be used to reimburse the staff or the individual for purchasing health insurance and paying that premium.
Okay, great. Thanks for
Yeah.
that
Yep.
clarification. Yeah, I think it's the acronym problem.
It is. And as HSAs become more commonplace and more popular, right, it's only worse because then it's like is an HSA or an HRA, like what is going on? So yeah, I feel you.
Okay. Sandy also asked, can unions use an HRA?
Um, yeah, I mean, that's an interesting question. I think that would largely depend on like the collective bargaining agreement, right? With the business is what type of health insurance benefit is offered. Um, so it depends. I mean, I guess that's like if the union agrees and the business agrees to offer an HRA and that becomes part of the collective bargaining agreement, um, I don't think the unionization status of a workforce would impact whether or not like they would be eligible to go that route.
Okay. All right. Anything else? Does anyone have a question? This is a great time to ask Cameron, but you can always follow up with an advisor as well. Okay. I'm not seeing anything else. So it sounds like there's the one question, Cameron, you were going to investigate about an
Yep.
ESOP.
Yep. Absolutely.
Um, so we will, when he finds that out, and when we send out these slides in an email, we can address that question. But yes, please feel free to reach out to Cameron, reach out to me. He's going to be your expert on this topic, but there's lots of resources, and the CoverMe website that Cameron mentioned is really, really helpful. I've sent a lot of people to that site to just really understand what your options are and how you can start offering a benefit to employees just like the big employers do. And as I said, we'll send these slides out to you, and I think that's it. But thanks again, Cameron. Really appreciate it. And just a plug for a future webinar, Cameron is going to be coming back and talking to us about retirement options for small business owners, because that's another really important topic that we get questions about and can be equally as confusing. So thank you for doing that as well. That's going to be in May, I believe.
Awesome. Yep. Thank you all.
All right. Thanks, everybody.